Living with pain that just won't go away, it's so much more than a physical thing. It can be completely draining, affecting, well, every part of your life. So today, we're going to walk through a modern, evidence-based way to not just manage that pain, but to actually overcome it and get back in the driver's seat. Let's dive right in. This is the big one, isn't it? That incredibly frustrating feeling. You think you're finally turning a corner, things are getting better, and then, bam, the discomfort is back. That cycle is one of the biggest struggles we see with people dealing with persistent pain. And it really goes so much deeper than just the physical feeling. This constant battle. It messes with your sleep, your mood, your ability to focus at work. It can make you lose confidence in just living your daily life. Honestly, it's a heavy weight to carry around. So to find a way out of that loop, we first need to really understand this cycle itself. Let's take a closer look at what that experience actually looks and feels like for so many people. Does any of this hit home for you? We're talking about pain that's just stuck around for more than 3 months. That nagging ache in your neck or back that keeps showing up. Or that stiffness that makes simple things, like getting out of a chair, feel like a huge deal. It almost always leads to this fear of movement, which just feeds the whole cycle. And if you're feeling this, you are definitely not alone. We see this in people from all walks of life right here in Dubai. Hardworking professionals, busy parents, active seniors. It's a shared struggle for sure. But the good news is, it's one that has a real solution. Okay, now we're getting to the most important part of this whole conversation. Because to really change the outcome, we have to completely rethink what pain actually means. This right here, this is the breakthrough moment. I want you to really let that sink in. Once pain has been around for a while, say, past that initial 3-month mark, it's often not a sign that you're damaging your body. It's still a signal, yes, but what it's signaling has fundamentally changed. So what's going on here? Well, there's a term for it, nervous system sensitization. The best way to think about it is like a fire alarm that's gotten way too sensitive. It's going off just from a piece of burnt toast, not an actual fire. Your nervous system can do the same thing. It gets stuck on high alert in this overly protective mode. And just knowing that is so incredibly powerful. It shifts the whole goal. We're no longer trying to fix a broken part. Instead, we're working to calm down that sensitized system and gently retrain it to feel safe with movement again. This understanding is truly the foundation for getting better. So, how do we actually put this into practice? Let's walk through what a modern, person-centered plan for healing really involves at our clinic. It always starts with a really thorough one-on-one assessment. We need to hear your story. We'll look at how you move, and together we'll identify the triggers, and maybe even some habits that are keeping that pain cycle going. But most importantly, we need to know what you want to get back to doing in your life. That's our true north. From there, the treatment is all about building your confidence back up. We often start with some gentle hands-on therapy, just to help calm the system down. Then we slowly introduce movement and strength exercises that are tailored right to you. And a huge piece of the puzzle is education, helping you understand how to manage your energy and how to handle flare-ups so you feel in control again. You see, our goal should always be to empower you, not to create dependence. Some treatments might give you a temporary fix, but the real win is when you gain the tools and the confidence to become independent and really to learn to trust your own body again. So, what does this journey actually look like when you zoom out? Let's talk about the kind of positive changes you can realistically expect from this approach. With consistent care, the results are genuinely life-changing. We're not just talking about the pain itself getting less intense or less frequent. It's about your confidence in movement coming back. It's about being able to get through your day with more ease. The fear goes down, sleep gets better, and you just feel, well, better overall. And while this is a steady process, not an overnight fix, it's so encouraging that many of our clients start to feel that positive shift, that little glimmer of hope within just the first few sessions as they start to put these new ideas into practice. Of course, choosing a partner on your health journey is a huge decision. So let's talk for a moment about the kind of commitment and qualities that are so important to look for in a physiotherapy team. You really want to look for a team of experienced, fully licensed physiotherapists who are committed to an evidence-based approach. A supportive environment that looks at your whole well-being is key. And here in a city as diverse as Dubai, having a multilingual team that can connect with everyone is a huge plus. Now, I really want to highlight this one, one-to-one care. This is non-negotiable. Having sessions where the focus is 100% on you, your goals, and your long-term improvement is vital. That personal attention is where the trust is built and where real, lasting results come from. So if there's just one thing you take away from all of this, please let it be this message of hope. You do not have to just accept persistent pain as your new normal. With the right structured, supportive, and understanding approach, you can absolutely get back in control of your life. So the only question left is the one for you. Are you ready to start that journey? Ready to finally break that cycle of pain and start moving with real confidence again?